Hey everybody, this is going to be the first part in what is eventually going to be a crash course of Gulf Coast State College of Nursing. My name is John, for those who don't know me, and I'm going to be using this as an opportunity to kind of break down our basic care PowerPoints and maybe farm if I get there. And the way I'm going to be doing it is taking the objective PowerPoints and getting information from the book so that you don't have to, and so that you will get to listen to a lecture that is directly related to our content instead of having to spend all that time finding the information yourself. So the first injection type I'd like to cover are intradermal injections, otherwise known as ID injections. We are responsible for knowing the size and gauge of the needles used, the preferred site of entry, and the degrees of entry, which I've abbreviated as DOE. So to begin, ID injections are particularly short and skinny. Their gauge size is going to be from 26 to 28, and the needle is about ½ an inch long. The preferred entry site, as I've attempted to illustrate here, is the anterior forearm. Anterior, if you remember medical terminology, is going to be the front-facing side of the forearm, so it's going to be in this area. So we're going to say our preferred site is the forearm. And the entry degree is particularly shallow, more than any other type of injection. You're only going to be going about 10 to 15 degrees laterally. So that is 10 to 15 degrees. So the process for giving this injection, it looks very similar to the illustration. You're going to slowly inject the needle underneath the skin, and you should be able to see the needle protruding up into the dermis. And as you begin to inject the fluid slowly, you'll see a bubble begin to form, indicated by the red coloring here. And that's how you know your fluid is getting through correctly. So the next type of injection I want to look at is intramuscular, or IM. The first thing I want to look at is the procedure for this injection. So as I've illustrated here, it's very different from intradermal. The first thing to notice is we are responsible to know that we need to hold the syringe the way you would hold a dart, between your thumb and your pointer finger, going in to the injection site at a nice 90-degree angle. You want to use your offhand to stretch the skin, and you will just press, or like jab, I guess, the needle into the injection site. Slowly depress the plunger with your dominant hand, remove the needle, pressurize, and gauze the injection site. So what we need to know for the needles themselves is that they are a little bit thicker and a little bit longer than intradermal needles. The gauge for intramuscular needles are about 20 to 25, and the size can go between 1 to 1.5 inches. And as we talked about a second ago, the degree of entry for this is always 90 degrees. Cool. What I want to look at next are the landmark sites for the intramuscular injections. So we color coordinated these images. Blue are our landmark bones, red are our muscle areas, and the green dotted areas are where we are actually giving the injection. So for this first one, the vastus lateralis, what you should really remember is your medical terminology. Know that lateral indicates away from the center of the body. So we are looking for the lateral muscle group in respect to the femur. So this little section of that muscle is where you're giving your injection. For the deltoid, you want to make a space between the achromic process and the humerus. The way I remember it is that they taught us that you want to make a C, so you make AC for achromic. If that helps you remember it, that is fantastic. Just know that these are those landmark bones, the achromic process, and the humerus. That muscle group up in the shoulder is what you're looking for. And lastly, in the ventrogluteal, what you want to do is you want to keep your arm in line with the femur here, and then part your fingers into a V shape at the iliac crest at the top of the glute. Can't see it, the camera's too far up. But this big muscle space, you only want the section that is that comes up from the femur up to the iliac crest. So the final type of injection we're responsible for knowing are subcutaneous injections. I think the most common we're going to experience are insulin injections, but let's go ahead and go over the information that we need to know. First is the procedure of giving this injection. As I've attempted to illustrate here, the process for giving this injection is pretty similar to intramuscular injections with just a couple of differences. The first is that you're going to be using your offhand to pinch the skin at the site of the injection, not stretch it. The site that I've marked are 2 inches away from the umbilicus, the belly button. That is one of the landmarks, and we'll go over the other ones in just a second. You're going to take your syringe and inject it between 90 and 45 degrees. The less fat the patient has, the shallower you want that degree of injection. So, degree of entry is going to be 45 to 90 degrees. Sub-Q injections, sub-Q syringes are also skinny and small, like the intradermal ones are. They're going to be about the same size at 1/2 inches, and roughly the same gauge between 26 and 28. However, insulin needles can be even skinnier. So I'm just going to go ahead and mark here that insulin gauge is between 26 to 30. So let's go over those final landmarks. So the final thing we're going to discuss for this chapter are the subcutaneous landmarks. It's pretty easy to get the concept of. Pretty much anywhere where there's going to be a decently large amount of fatty tissue in the body, that's going to be your landmarks. But we are responsible for knowing 4 of them, and these are the 4. So the first is the upper anterior arm. That's going to be much more commonly the tricep, but a lot of it is based on the terminology of the anatomical position. So we need to know upper, anterior, meaning front facing. So when you think of the anatomical position, anterior is going to be right here. So that's how you know. The fat in your tricep. And then the lateral anterior thigh, like we talked about earlier, lateral means away from the center. So we're basically going to the outside of the thigh. This is a left arm and a left leg anatomically. So you're looking for the outer part of that thigh tissue, and that's your injection site. Next is the ventrodorsal gluteal area. This is going to be a section that's right above the glutes, and at the bottom of the back. The dorsal part of this refers to the base of the spine, just in anatomical terms. And last is the abdominal site. Like we mentioned with the procedure of giving the injection, you want to make sure that your injection site is at least 2 inches away from the umbilicus. And I think, that's a wrap for chapter 21 injections. Thank you guys for letting me present this to you. Let me know if there are things you would like to see me cover. I record this stuff per section, so it'd be pretty easy for me to jump back and change something or correct something if need be and re-upload just so that we have accurate and condensed information. Thank you guys.